Taking a research year after going unmatched isn't the only viable option if you still want to pursue ophthalmology. Here are the main paths forward, roughly ranked from most likely to improve your odds to least. Generally, a formal pre-residency research fellowship would be viewed the most favorably among program directors. It shows clear dedication to ophthalmology and also gives you the most opportunities to improve your application for next cycle, whether it's through more research, more connections, or clinical skills. Oftentimes, these research fellowship mentors also have a lot of experience working with unmatched applicants, and so they will advocate for you heavily during your re-app cycle. Remember, it's in their best interest to maintain a high match rate for their previous fellows too, so they are more likely to be invested in your success. That combination of structure, mentorship, and optho involvement is what makes this option really powerful. Another option is to just do anything optho related, of which there are a couple options here. One, you could do an informal optho research year either at your home institution or some nearby institution. This is still viewed positively since you're still staying engaged in ophthalmology, but your experience can vary widely depending on the mentor you have. There is no established track record, and so this can be a bit of a gamble. Another option to stay involved with ophthalmology without necessarily doing research is by doing a bunch of away rotations. This allows you to have more face time with specific programs and can really increase your odds of matching at one of those programs during your re-app cycle. This usually works best if you can defer graduation to maintain student status and your insurance, but even without that, this is sometimes still possible through observerships. However, keep in mind that this can get really pricey if you're traveling across country every month. One successful reapplicant who matched after doing this did 5 away rotations during their gap year. A prelim year is generally viewed less favorably than any of the other previous options because realistically, during a busy intern year, you won't have that much time to improve your ophtho application. That said, this path does open up something that the previous options don't, which are open PGY2 spots. These only become available when a PGY1 leaves the program, so these are unpredictable and definitely a gamble. But it does open up that additional pathway, especially if taking a gap year isn't financially feasible. Lastly, you could SOAP or match into a different specialty altogether. This is usually the hardest route back to ophtho, but not impossible. Applicants who match into IM or surgery are still eligible for any open PGY2 spots that may pop up later. Another adjacent option is to match neuro with the goal of doing neuro-op fellowship. This is often the closest alternative to ophtho if ophtho itself doesn't work out. I know re-apps who have matched in ophthalmology through each of these paths. So if you've gone unmatched and still want ophthalmology, but applying to formal research fellowships just hasn't been working out, that doesn't mean that the dream is dead. Your path might look a little different, but there are still ways forward.